We got the survivors out of the OR. We did what we could for them. We realized it had spread to the rest of the hospital when we were looking at multiple casualties. Little did we know that the real disaster hadn't even started yet. But I was handling it. I was making decisions, I was setting priorities, and in between everything, talking to you guys, keeping you up to date. I couldn't stop thinking about one of our OR nurses, Elizabeth Weber, or Spencer, I'm not sure which is going at right now, but she's got these 2 little boys. I couldn't stop thinking about Elizabeth leaving her 2 little boys, and I should have been thinking about Robin and Emma. I should have been with them.
What happened?
Head-on collision. Contusions, patient complains of pain in her wrist.
Yeah, but I'm sure it's just a sprain, which is what I tried to tell this nice man, but he insisted on bringing me here anyway.
That's why he's good at his job. Come with me. Thank you.
That guy came out of nowhere like a bat out of hell.
You're distracted.
I can do my job.
Why? You don't have to. Perfectly capable of taking over here. Okay, look. You have your wife and a newborn baby at home, alone, with a blizzard on the way. This is just one patient out of many surrounded by one of the greatest surgical teams that General Hospital has to offer. I don't mind saying so myself. So if you think there's a chance Robin might need...
This is silly. You know, I've got a bump on the head and a sprained wrist. I shouldn't be taking up space in the ER.
Well, I can't release you until you've seen a doctor, and I don't want you walking out of here with an undiagnosed concussion.
Okay, that's a good point. I guess I shouldn't press my luck.
So this guy just ran into you out of nowhere, and then what happened?
Well, gosh, I skidded off the road, and he slammed into a tree hard. I just, you know, I wouldn't bet on his chances of survival.
Oh. Abdomen's very distended.
Probable internal bleeding. Epiphany, do we have a name yet?
Earl Bragg.
Okay, Mr. Bragg.
Help me, pain so
We're gonna
bad.
we're just gonna need to take some tests first, all right?
Easy. Easy. How's the pain?
It's still there. Still bad.
Sir, I know. You need to take a deep breath, okay? We believe the test results are going to reveal internal bleeding. Probably gonna have to open them up.
Might not have to. Bleeding might not be as bad as we think. Test results and x-rays will be here soon. I say we wait.
Elizabeth's with a head confusion in cubicle 2. She needs a doctor to sign off before she can release the patient.
I'll get it. Keep monitoring Mr. Bragg and notify me if anything changes.
Yep, my offer still stands. Go home if you
I've
want.
got it, Matt. Thank you.
Sam was involved in a car accident, head-on collision. She has a bump on her head.
Well, you should see the other guy.
He's here?
Yeah, he's in trauma 1, so he hit you?
Yeah, I'm really hard. I think he was going way too fast for the weather conditions, if you ask me.
Well, he's going to pay for it with serious internal bleeding. He's probably going to need surgery. Can you stand by for scrubbing?
Yes, absolutely.
What are you doing?
Examining you.
Oh, okay, but Elizabeth already did this.
Humor me, Sam.
Okay. So, how's the family?
Emma is amazing. Follow my finger. Seeing the world through her eyes is, well, it's eye-opening.
What about Robin?
Robin. Well, that's a different story. I love Robin and Emma more than I ever thought possible, and just tell me if I'm crossing the line here, but you had emergency C-section a few years ago, so you would understand. See, it's taken Robin quite a while to recover.
Oh, gosh. I mean, I honestly don't remember the operation at all. The pain of losing my daughter sort of took over.
I'm sorry, Sam. I should have never said anything.
No, don't worry. There's no harm done. I actually think I get what you're trying to say. And you're really worried about Robin.
Pain so
bad.
I'm sorry.
Something wrong. You got to get it out.
Okay.
Sir.
Meds don't seem to be having any effect. The patient's still complaining of severe abdominal distress.
Okay. Up the pain meds, 5 milligrams. We're in a holding pattern.
Don't tell me radiology's back.
Oh, yeah. What else is new? Patrick doesn't want on the table until he's seen the films.
Well, you're not gonna like this, but I'm gonna order you a CAT scan.
No, I could wind up sitting here all night waiting.
You've got other plans, Sam?
Yeah, I have to pilot a ship into the harbor tonight.
Really, in a blizzard?
Hazard pay.
Okay, well, I can't force you to stay, but don't blame me or the hospital if you pass out in the cold, which is gonna make it a little bit difficult to pilot that ship.
Okay, fine. Knock yourself out. Patrick.
Yeah.
You asked what happened with my C-section, and I know my situation was completely different than with Robin's. I mean, her baby did live, and mine died. But for what it's worth, whatever happened between me and Jason after, at the very worst time of my life, he was by my side, holding me when I cried, listening to me talk. He even buried my daughter when I couldn't. So I'm just saying that knowing that I had that, someone who loved me, if you can give Robin that, sustain her the way Jason did me, I think that's all she'll need. I mean, it'll get her through it.
Thank you.
What have we got?
His abdomen's very distended. He's bleeding to death internally.
His pulse is 150. He's going into SVT.
What do the labs and x-ray show?
Oh, we haven't gotten back yet.
What?
Yeah, we don't have time to wait.
No, you don't. It looks like he's going into cardiac arrest.
Leyla, have him prep OR2 stat. And have the lab send the blood there.
I'm going to meet you there. I'll assist, because if he codes, you're going to need another pair of hands.
Hey, any changes? Still waiting on those x-rays. He's going to SVT.
Okay, I'll do the surgery.
Could you stop trying to steal my glory? Monica Quartermaine agreed to assist on the surgery. Go home to your wife and kid.
Fine. He's all yours.
All right. Tell Robin she's welcome.
I believe you were waiting for Mr. Bragg's
He's already
x-rays.
gone to the OR. Wait, let me just take a quick look. Thanks. Oh my God. What the hell?
ER. Yes, Earl Bragg was admitted tonight. Well, he's already on his way to the,
This is Dr. Patrick Drake. Why are you asking about Earl Bragg? Poison. Yeah, I know where it is.